Hi, this is Natalie Sandhouse, communications class. I'm here to do my persuasive speech. I have my audience member here, my husband.
Hello.
How do you think new medications are approved for use by the FDA? The answer is through the use of clinical trials. If you take any medications that are prescribed by your physician, then that drug was once used in a clinical trial. I have the opportunity to provide health care and help healthcare advance. I'm providing healthcare to some people who wouldn't otherwise be able to obtain it. Clinical research is important to the healthcare community because it aids in advancing medicine. It is also helpful to you and your family because it provides care to those who may not otherwise be able to obtain it. Not to mention that it could help discover the next medication that you or your family needs. For these reasons, I'm seeking to convince you that clinical research is not capable of advancing if you're not willing to participate. In order for you to participate fully, you need to understand the process of clinical trials. There are several phases in clinical trials that you could opt to participate. But first, there's pre-trial clinicals. This is where researchers find new molecules, side effects from previous medications, new insights into diseases, and new technologies. Once that is completed, there are 4 phases that you could participate in. Phase 1 is generally for a small group of healthy volunteers. There is often a good payment involved in this participation. This is to check on safety and possible side effects. So if you're healthy and you want to make a little extra cash while helping to advance healthcare, this phase of clinical trials could be for you. Phase 2 is when the volunteers with the diagnosis intended for treatment are introduced. Again, monitoring for safety and side effects is done. This would mean that you would need to have the diagnosis or condition that the drug is intended for. Phase 3 is for larger populations of the intended diagnosis. This phase is usually done in comparison to a more conventional drug. Monitoring for safety and side effects is continued. Again, you would need to have the disease or condition that this is intended for. And then there's phase 4. This is after the drug has gone to market and subjects are continued to be monitored for safety as well as monitoring for side effects. This phase is also done if you have the diagnosis or condition that this is intended for. These phases are what bring a medication to market, but what makes the clinical trial beneficial to you is the treatment involved in the clinical trial. There is a strict protocol designed for each study. While it seems that a protocol may be hard to follow, they are designed to measure if the drug is working and if there are any unintended side effects. There is a possibility in many trials to get a placebo. This is necessary for some sort of control and to know if the drug is working as it was intended to do so. Often, if you are given a placebo in a clinical trial, it's only until a certain point, and then there's a switch to the actual drug that is being tested. You could be asked to go to the office for procedures such as an EKG to check your heart, lab tests to check for abnormalities or changes, or even to have a physical done by a physician. Many people find this reassuring, though, because they are able to get more tests and care than the normal standard of care at no cost to you. Now, if you've read any books or seen any movies about clinical research, then you know that it has not always gotten a good rap. Movies like Miss Evers' Boys or The Immortal Life of Henrietta Lacks have shed some light on past clinical trials that were not done with the subject in mind. In fact, indeed, many trials in the past were not run with the safety of the subjects in mind. According to the CDC, there were trials that started in 1932, known as the Tuskegee trials, where African American men were not treated appropriately for syphilis, even though they were told that they were. There is also the case of Henrietta Lacks. According to SmithsonianMag.com, her cells were taken and made many discoveries in healthcare, but this was done without her or her family's consent. Many things have changed since then. For starters, the clinic you go to would be following GCP or good clinical practices. These are guidelines for clinical research. This means that there are a set of standards or guidelines on how any facility runs a clinical research program, and these are globally accepted standards. Also, there's the FDA. They mandate regulations and set standards in the U.S. for how clinical trials are run. There's also an institutional review board that approves and monitors the clinical trials in the U.S. They ensure that the risks are minimal, but the benefits, the risks are minimal and are worth any potential benefit, according to the National Institute of Health. So many of these changes have come, and there's many people overseeing the clinical trial. And some of the changes that came with all the regulations in place is a well-worded consent form. This form is in terms that lay people would understand and lists all the possible known side effects, as well as what is required to participate in that particular clinical trial. Of course, if you have questions about that form from the study doctor or the nurse can answer any questions before you sign it. And if any new medication about the study drug is obtained during the course of the trial, this consent form could be updated to make sure that you would still want to participate in that clinical trial. The other great thing is that you're not required to continue to participate. If at any time you have a side effect that you don't like, or you no longer, the schedule no longer works with yours, you can just withdraw consent. Thanks to clinical trials, there are so many new medications on the market. According to CenterWatch.com, there are 7 new medications to treat different types of cancer that are approved just this year. In fact, over 40 medications have been approved by the FDA this year so far. Your participation in clinical trials is vital for healthcare, for the healthcare community to be able to advance in science. There are many ways that you can participate in the clinical trial, either in the early phases as a healthy volunteer or by participating in a trial that is designed to treat a disease or condition that you have. According to clinicaltrials.gov, there are 43,002 clinical trials that are ongoing right now. That's a lot of opportunity for you to get involved.